Colorado lawmakers just wrapped up the first few days of the 2021 session. They are now adjourned for a month to prevent the spread of COVID. In those 3 days, they did pass 7 bills, including one that allows lawmakers to meet virtually in a disaster emergency. Another that allows living wills to be notarized remotely, one that extends limitations on debt collections, and a bill to help small businesses that have been disproportionately impacted by this pandemic. Now, lawmakers are already working on bills when they return, including one to help with burnout among healthcare workers. Political specialist Sean Boyd talked to a nurse and a doctor who were also state representatives.
We think of our healthcare workers as warriors, soldiers on the front lines of the pandemic. But those warriors are weary after 10 months of an unrelenting war on COVID. Our heroes need help. And 2 lawmakers who know the demands firsthand are leading the charge. Maybe no one at the state capitol knows the cost of COVID more than Representative Kyle Mullica. An emergency room nurse, he thought he'd seen it all until last March.
I'd never seen the fear that I saw in my colleagues' eyes.
Today, he sees something else: exhaustion, depression, suffering, and stress.
I think that there's a real fear of a mass exodus. 10 months of this.
Yet as some healthcare workers suffer burnout, others are seeing layoffs. A pediatrician, Representative Yadira Caraveo, was furloughed, helpless as those like Mullica were overwhelmed.
Knowing that, if it had been taking care of an intubated child, I could help them with that, but taking care of an intubated adult is something that I've never done, and so I couldn't really just jump in and help them.
As they shared their frustrations, Caraveo and Mullica had an idea. What if they thought there was a way to train the underworked medical professionals to help the overworked?
The dream would be that we would have a group like the National Guard. So right now we're calling it the National Health Service Corps. Doctors, nurses, other healthcare professionals would be cross-training, learning how to take care of different kinds of casualties, different kinds of issues, different populations.
They have the degree and they have that skill set that they can get there, but they're not running a ventilator every day like an ICU nurse may be, but they can get that training. We can have all the beds that we want. We can, we have a lot of hospital beds in Colorado. Doesn't matter how many beds you have. Can you staff those beds? See, as we want to see Colorado take the forefront on this, we want to see Colorado be prepared. We don't want us to be relying on anyone else.
Caraveo and Mullica envision the Health Service Corps responding not just in a pandemic, but any emergency where a number of healthcare workers are needed on short notice. Because there's nothing like this in the country, there are a lot of details to work out, like who oversees the Corps, provides the ongoing training, and pays for that training. The legislation would set up a task force to figure out just how to make this dream a reality. At the Capitol, Sean Boyd covering Colorado First.